Hi everybody, Dr. Demetrios Kydonieus, chiropractic nutritionist, coming to you from Ruckersville, Virginia. And I wanted to go over a little bit of your chiropractic expectation when you see your chiropractor. So you haven't been to the chiropractor in years, or you've never been to the chiropractor, you're over 50, so let's just target this to people over 50, seniors, 60, 70, 80 years old. I had an 85-year-old new patient yesterday, hadn't been to the chiropractor in 20 years, and she was having terrible low back pain for about 3 months. Muscle relaxers from her MD weren't working, Advil, Tylenol, Aleve were not working, and her pain was slowly getting worse and worse. And so she comes in, we do our evaluation, we do x-rays. She's 85, she's slender, in good shape, very active person, drives, mentally alert, does very independent, but now she's bent over like this because her back hurts, and she says her family's always yelling at her to stand up straight, but when she does, it hurts. X-rays show she's got osteoporosis, very weak or frail bones, no fractures, no tumors, no bad stuff. She's got a scoliosis. Her back is kind of kinked like this, and the pressure over a lifetime has worn out the lower discs in her low back. So she comes to me about, about a week and a half ago. She's got a vacation coming up in 2.5 weeks, and she wants to be out of pain in 2 weeks. She's 85. She's had this problem for 3 months that it's been getting bad enough, which means she's actually had back pain or symptoms telling her to go get it fixed for at least a year, if not longer, on and off for, say, the last 5 or 7 years at the very least, late 70s to now. And she comes to the chiropractor, heard good things about me that I can really help her, helped a lot of her friends get out of pain pretty quickly, so she wants to be better in 2.5 weeks. Her x-rays tell a different story. Her exam shows she's actually got a bulging disc, even though her disc is pretty worn out. The little bit that's left down there is bulging, putting pressure down on the nerves that go into her legs. Generally, her diet is pretty fair. She is not a bad eater, although she does, like a lot of seniors, tend to eat a little more sugar. As we get older, taste buds dull. We need salt and sugar to really make our taste buds wake up. So we tend to eat more salt and sugar as an older person than we did even if we ate really healthy as a younger person. So fast forward, 2 adjustments, a little bit of relief, not significant. I told her before we even started, after reviewing her exam and x-ray results, that she was going to take at least 30 days to significantly reduce her pain, but it would take me 90 days to really reduce her pain and 6 months to a year to stabilize her spine and keep her active lifestyle going. Fast forward a week, 3rd visit, calls, cancels. She's got a bowel blockage. She runs to the ER. It's not actually blocked, but they give her some Imodium and stuff to just kind of clean her out, and her intestines feel a little better. Severe pain. Of course, intestinal problems will refer low back pain. Can't see those on x-ray. Can't really find them on orthopedic tests. No complaints initially on my nutrition half of the exam. Basically bowel habits, urination, pretty normal, although she does have frequent constipation for decades. So I know there's a nutritional problem going on. How severe it is at the initial onset, you can't tell. So we start with chiropractic, and then, of course, turns out there is some intestinal stuff going on. So her idea of just feeling better and going on vacation is gotten a little squelched. What's the point of all this? You got to see the holistic doctor, the natural doctor, the chiropractor, the naturopath, the acupuncturist, okay, the homeopath. You've got to see that doctor, even the functional medicine doctor, the doctor who uses lab work to do nutritional support versus using drugs. MDs, chiropractors, naturopaths, homeopaths all do functional medicine. So don't get confused on the terms. So my point here, back to this particular case, is that she should have been here 3 months ago, 6 months ago, when it was a nagging pain and her posture went from probably pretty good, slowly worse, slowly worse, slowly worse, to pain. Okay? The pain zone is the last part of a disease process, and in the healing process, pain is the first thing to go away, but it doesn't mean you're better or you're healed. Continued holistic chiropractic nutritional care is necessary for months after that to stabilize your spine and improve your posture. So don't wait too long. When those warning bells happen and you are over 50 years old, especially over 60, let alone 70s and beyond, that is a warning sign that you need to go now when it's a nuisance pain versus a debilitating severe pain. Because when we're older, pain creeps up a little slower, although the bones are getting crunched and out of place even worse. So take those tips to heart, call your chiropractor or a chiropractor, make that appointment before your pain gets severe enough to interfere with your vacation plans or your family party that you're planning for the 4th of July. So Dr. Demetrios Kydonieus signing off, wishing everyone a happy, safe summer, and see your chiropractor.